So, hello students, continuing with the previous lecture, that is of the different parts of the ulna. So now I am going to discuss the different attachment on the ulna, that is muscular attachment. So what is important, what to remember for ulna is that three muscles are inserted on ulna. So that you remember, number one is tricep. Now this tricep is inserted at, this is the superior surface of olecranon process, you know it. So it has posterior part. So to the posterior part of this olecranon process, the tricep muscle is coming and getting inserted on this portion. Then comes the brachialis muscle. So next insertion is of brachialis, which is on this rough area below the coronoid process and ulnar tuberosity. So rough area below the coronoid process and the corner of that rough area is known as ulnar tuberosity. So this region is receiving the insertion of brachialis. So what is left is anconeus. So third muscle which is inserted on the ulna is anconeus, that is inserted. This is the olecranon process. Now this olecranon process has this lateral surface. So to the lateral surface of the olecranon process and the upper 1/4 of the posterior surface. I told you that posterior surface is divided by a ridge into upper portion, that is triangular. So this triangular portion is receiving the insertion of anconeus along with the lateral surface of the olecranon. So these are the insertions. Now coming to the different muscles which are getting origin from the ulna. So out of this, first is the supinator. So you know it, this is the supinator crest. This supinator crest is continuing with the interosseous border of the ulna. So this supinator crest is giving origin to the supinator muscle along with the rough area. So there is a rough area in front of supinator crest. So this rough area is again giving origin to the fibers of the supinator muscle. So this is the origin of supinator muscle. Then comes the muscles of the flexor compartment of the forearm. Now in the flexor compartment of the forearm, first is the pronator teres muscle, then comes the pronator quadratus muscle. Now this pronator teres muscle is getting origin from the medial margin of the coronoid process. So from this the pronator teres is getting origin. And pronator quadratus, if we see the anterior surface of this, I told you that anterior border is just going backward and ending at the styloid process. Now at the same time on the anterior surface you can see an oblique ridge. So there is an oblique ridge which is visible in the lower portion. I show you again. So this is the oblique ridge which is visible on the anterior surface. Now this oblique ridge is giving origin to the pronator quadratus muscle. Clear? So pronator teres is arising from the medial margin of the coronoid process and pronator quadratus is arising from the oblique ridge which is visible in the lower portion of this. You can see here. So from here the pronator quadratus is getting origin. Now coming to the flexor carpi ulnaris, this flexor carpi ulnaris is arising from the medial side of the olecranon process. Now this is the olecranon process. This is the olecranon process. So this is the lateral part, this is the medial part. From the medial part, the flexor carpi ulnaris is arising along with those fibers are getting origin from the posterior border of this ulna. Now here the fibers which are arising from the posterior border of the ulna, basically those are the aponeurotic fibers. Along with that, the fibers of the extensor carpi ulnaris muscles, they are also getting origin. So that is important. So third muscle which is getting origin along with this aponeurosis is flexor digitorum superficialis. So these are the muscles: flexor carpi ulnaris, pronator teres, pronator quadratus. So what we are left with? Next deeper group is flexor digitorum superficialis. Now flexor digitorum superficialis muscle is rising from the upper and medial margin of the coronoid process. So this is the coronoid process. So upper and the medial margin of the coronoid process is giving origin to the fibers of the flexor digitorum superficialis. And third important thing which is related with flexor digitorum superficialis is, as the fibers of the flexor carpi ulnaris, they are arising from this posterior border to upper 2/3 portion of this posterior border. So those are the aponeurotic fibers. So that aponeurosis is also giving origin to the fibers of the flexor digitorum superficialis. Otherwise, this is the coronoid process from where the flexor digitorum superficialis fibers, they are arising. Now coming to the flexor digitorum profundus. Now it has anterior surface. This shaft has anterior surface, it has medial surface. So upper 2/3 portion of this anterior and medial surface is giving origin to the fibers of the flexor digitorum superficialis, and that origin is also extending to the medial surface of coronoid and oligocranial process. So this whole portion is giving origin to the flexor digitorum profundus, that is from the anterior surface of the shaft, from the medial surface of the shaft, and both these origin they are extending up to the medial surface of coronoid and the oligocranial process. So this is about the flexor digitorum profundus. Then third group is flexor pollicis longus. That flexor pollicis longus is arising from the lateral margin of the coronoid process. So this is the coronoid process. So from the lateral margin of the coronoid process, the flexor pollicis longus muscle is arising. So these are the flexor muscles which are arising from this. Out of this, pronator teres is the superficial muscle. Then comes the flexor carpi ulnaris, that is again the superficial muscle. Then comes the deeper group is flexor digitorum superficialis, and deepest layer is of flexor pollicis longus, flexor digitorum profundus, and pronator quadratus. So these are the muscles which are getting origin from the oligocranial, coronoid, and the part of the shaft. Now coming to the part of the anterior and medial surface of the shaft only, so flexor compartment. Now coming to the muscles of the you can say extensor carpi ulnaris. One muscle is of extensor compartment of the forearm, that is extensor carpi ulnaris. Then two muscles of the thumb, that is abductor pollicis longus, extensor pollicis longus, and one muscle of index finger, that is extensor indicis. These four muscles, they are arising from the you can say posterior aspect. Now I told you that flexor carpi ulnaris is getting origin with the flexor carpi ulnaris from the posterior border of the shaft of humerus as aponeurosis. So aponeurotic fibers, they are common for three muscles, that is flexor carpi ulnaris, extensor carpi ulnaris, and flexor digitorum superficialis. So this is important. If anybody asks that what are the different muscles which are arising from the posterior border, so those are the fibers of flexor carpi ulnaris, then extensor carpi ulnaris, and flexor digitorum superficialis. Now, as I have told you in my previous lecture, that posterior surface of the shaft of ulna is divided by two lines. One line is oblique line, which is dividing it into the upper triangular portion and the lower portion, and the second line is the vertical ridge, which divide it into this medial portion and lateral portion. So this lateral portion is between this ridge and the interosseous border. That is important. So no confusion is there that we have to discuss the attachment on the lateral part of this lower part of the posterior surface. So lateral part is between the vertical ridge and in the interosseous border. Now starting from this portion, that is below that oblique line, so we divide the area into four parts, that is upper part, first part, then second part, third part, and fourth part. First part is giving origin to the fibers of the abductor pollicis longus. Second part is giving origin to the fibers of the extensor pollicis longus. Third part is giving origin to the fibers of extensor indicis, and fourth part does not give origin to any muscle. So that is one important thing. And the medial surface of this posterior surface is not giving attachment to any muscle. So that is important. So in the posterior surface, upper portion above the oblique line is receiving the insertion of anconeus muscle, that is important, and the lower portion of the posterior surface, which is divided by a vertical ridge into lateral and medial part, only lateral part is giving origin to the muscles, that is to the three muscles, abductor pollicis longus, extensor pollicis longus, then extensor indicis, and medial portion of this posterior part and lower part of this lateral part does not give attachment to any muscle. And the next is a attachment of different ligament. I have already discussed those ligament in my previous lecture. Just a repetition that capsule of the elbow joint is attached to the margin of trochlear notch except the area over the radial notch. Anterior and posterior end of the radial notch give attachment to the annular ligament. Lateral border is giving attachment to the interosseous membrane. Styloid process is giving attachment to the ulnar collateral ligament, and lateral surface of the styloid process is giving attachment to the articular disc of the inferior radioulnar joint. So this is all about the attachment on the ulna. Thank you.